What if I told you that the future of healthcare is at risk and the very doctors we rely on to heal us are facing an alarming crisis? Imagine waiting in a never-ending queue for treatment, struggling to find a doctor, all due to a growing scarcity in the medical field. Today, I will be sharing a spotlight on the global threat that is affecting medical practitioners worldwide: physician burnout. With highly adverse consequences, this epidemic demands our attention and action. The 2020 Medscape National Physician Burnout and Suicide Report ranked the incidence of burnout in 29 medical specialties. The top 3 medical specialists for burnout are urology, neurology, and nephrology. The lowest incidence of burnout is reported in general surgery, psychiatry, and orthopedics. In the United States, recent studies show a significant surge in physician burnout, with 62.8% of physicians experiencing at least one manifestation in 2021, compared to 38.2% in 2020. Also, the American Medical Association records suggest that the figure has nearly quadrupled between 2020 and 2021. Our concerns aren't limited to the US. In India, a total of 15 studies assessing burnout in 3,845 Indian HCPs were identified. The pooled prevalence of burnout was 24% in the emotional exhaustion domain, 27% in the depersonalization domain, and 23% in the personal achievement domain. In Canada, a survey of 4,000 physicians and residents done by the Canadian Medical Association in November 2021 showed 53% have experienced high levels of burnout compared to only 30% 4 years ago. In Europe, a systematic review from 2006 to 2018 among physicians practicing in 41 European countries showed that burnout prevalence rates ranged from 2.5% to 72%. A difference is observed between the European Union countries and the non-European Union countries. Within the European Union countries, the incidence of burnout ranges from 4.3% in Finland to 20.6% in Slovenia, and within the non-European Union countries from 13% in Albania to 25% in Turkey. This study indicated that burnout at the country level seemed positively related to the workload. Also, a survey of inpatient versus outpatient providers found that outpatient providers reported more emotional exhaustion than inpatient providers. Additionally, gender disparities are evident, with female physicians experiencing higher rates of burnout compared to their male counterparts. Let's dive into the driving factors for higher burnout in women physicians. Differences in resources, higher workload, challenges in work-life integration, less autonomy, barriers to meaning at work, and organizational culture factors. Healthcare has experienced major challenges with an aging population, managed care, and the integration of technology. The reality of these challenges can be seen in long working hours, lack of cooperation at work, lack of individual and organizational value alignment, administrative work, electronic health record, lack of leadership support, high and sometimes unsustainable productivity goals, and greater overall difficulty of balancing work and life, all of which are some of the major precursors of physician burnout. Constant stress and anxiety at the workplace can lead to physical and emotional exhaustion among medical practitioners, which can lead to depression, substance abuse, and suicidal tendency. Lack of interest in a job due to a negative environment also causes poor rapport with patients, errors in diagnosing and treatment planning, poor quality of work, patient safety issues, decreased patient satisfaction, lack of provider engagement, low retention rate, and early retirement. Hence, the antidotes for burnout are teamwork, facilitating time management, reducing unwarranted working hours, minimizing work pressure, fostering work-life balance, implementing mental well-being practices in the workplace, leveraging technology to streamline operations, moving from fee-for-service or volume-driven healthcare to adopting value-based care. If you're passionate about staying updated with the latest topics in the medical field, do join us and become part of a vibrant MedSynapse community where you can engage with fellow doctors and gain access to valuable information. Thank you for watching, and remember, together we can heal our healers.